To diabetes now.
Okay. Diabetes mellitus is very simple. Is the cause is sugar. But we will break it down the elements further. Most of the problem comes from food intakes. They're the most dangerous one of all. They contain fructose. Fructose is your ability to control your blood sugar is controlled by blood glucose. Fructose has no control of your body because it controls it just messes up the body because the body controls the blood glucose, not the fructose. So it damages your system. Even though you're eating foods that are low glycemic index, it doesn't mean it helps prevent diabetes. It actually causes it. I've seen one patient who has orange juice every day, and they have to get their legs cut off because of that simple thing of drinking the fruit juices. Most fruit juices, such as orange juice, anything that contains fructose, affects your blood glucose. If you don't believe me, you can measure your blood glucose also. It kind of affects that too. The other thing that you don't imagine to cause it is the vegetable oils, the oils in general. They block the hormones signals to produce the insulin necessary to control the blood glucose. So you try to reduce the oil intakes and reduce the food intakes, especially the sugar, the fructose. The third one is the breads, white bread. They kind of cause blood sugar to be high also. The other thing you have to observe is that we're trying to eat after 6. After 6, the blood glucose goes very high. So you want to eat in those times. I can make a person...
You mean before 6?
We try to eat before 6, not try to eat after 6. And try to eat limited amounts in the morning because that's when your blood glucose gets also high. Okay, those are the meals you can take is between 12 to 6. You can take the size of food to be the size of your fist. The things that you don't normally consider to be normal is not, such as grapefruits. They're high in those stuff. Corn, sticky rice are the common ones I've seen to cause the blood glucose to be very high also. So you want to eat corn. You want to eat the white breads because they're GMO. The wheat products are one of the first GMO to be used in the United States and India also, but they cause a lot of problems because they are gluten. Okay, so those things you want to avoid. You try to avoid fatty meals because it causes fatty liver. Once the fatty liver gets fatty, then it messes up your whole system.
Can you talk a little bit about fatty liver? Because I've never really heard of it until you mentioned it.
Fatty liver is a frequent condition in humans. I've seen them die from fatty liver because once the fatty liver is fatty, we call in medical terms to be steatosis. It's a damage of liver caused by non-alcoholic liver disease. The common cause is vegetable oils. It's the most common one, but also high in cheese, high in other vegetable fats. Those are the common ones.
Okay, so are vegetable fats actually worse than animal fats, or are all fats bad?
Well, vegetable fats are very hard to metabolize because they're long-chain triglycerides. The animal fats are basically easier because they're medium chain or they're so the closest one you can take is the medium chain triglyceride, which is found in coconut oil. The very long chain triglycerides are found in vegetable oils and they cause a lot of problems. If you can, I can do a demonstration without actually doing the experiment. If you can imagine the vegetable oils out in the sun for 30 days, coconut oil out in the sun for 30 days, lard out in the sun for 30 days, the one that gets bad is the vegetable oil. They become sticky glue, and they're similar compound found in the body. They accumulate in the body, become sticky glue, and cause a lot of problems with your vascular system.
We are told that fish oils are very good for us, omega-3 and 6. Is that correct?
Well, basically, human diets are deficient in omega-3 because we use industrial manufacturing of chickens. we try to make the chicken grow faster. We have omega-3 deficiencies, and we eat those stuff, and we end up with the omega-3 deficiencies. That's quite true, but if you have a diabetes, you will try to reduce inflammation. That's true also, but you try to limit all the oils, it's best. Once you limit the oils, you get your blood sugar under control, then you might consider taking some omega-3 now and then. But I usually recommend most of my patients, take about once every week. I don't take it every day. Otherwise, if you take it every day, it will cause weight gain in taking fish oils.
Okay, then. And we were saying that frying is a bad idea.
Yes.
Boiled and steamed is good, but is grilled okay? Because I hear sometimes that the heat from doing the grilling creates
hydrocarbons.
Yeah. So. Yeah. But it's okay in a small amount, or?
Yeah. Well, what I do is if you to over grill it, that's bad because the cooked food is overcooked. But if you grill it just slightly grilled and just eat the ones that not burned, it's fine.
Okay.
You try to avoid the hydrocarbons.
I like the burn bits, but I can live without them if they'll kill me.
Yes.
Okay, thank you. So with your diabetes patients, again, how many people have you treated, and what sort of success rate do you have?
Well, look, most people who are diabetic never come back to see me again because they said their blood sugar is under control because they maintain a strict diet. Just basically avoiding the times I told you. Try to eat those stuff, and there are other supplements you can take that control the blood sugar, such as lysine, because lysine is one element that reduces blood sugar. Chromium, vanadium, those are the common ones I use to prevent diabetes. But the most important one is N-acetylcysteine. That's
what again?
N-acetylcysteine.
N-acetylcysteine.
Yes. Okay. Those are needed because N-acetylcysteine helps prevent diabetes. If you have insufficient amount of it, it can cause it.
Okay, fine. And if we can go on now to, there's a little mosquito flying around our feet here, so I'm determined it's not going to get me, so forgive me for wandering around a bit. Okay, bad backs.
Bad back is a simple condition of a bacteria that causes back pain. I basically kill them very easily, but not permanently, but it prevents them from having another bad back in a couple months with a sound therapy. The other thing is I can take antibiotic therapy that can help too, but I don't like that. The other thing is the bad back can be caused by a spinal column pressing on the disc. The disc gets very flat. The reason why we get flat disc is because our inability to produce hyaluronic acid. If you take hyaluronic acid, let's say with my formula, I require about approximately 500 500 milligram per liter for half a liter of water with some sea salt to get them absorbed. You take 3 caps a day, 3 times a day. That will stop most of the back pain in about 80% of the cases after you take that for about a week.
Okay, just repeat that again, would you please? 500 milligrams
of hyaluronic acid.
500 milligrams?
Milligrams.
That's all?
Well, that's very costly, believe me.
It's half a gram?
Half a gram.
In half a litre of water?
Yes.
And you put it in a bottle
with some sea salt, let's say half a teaspoon of sea salt or something like that.
So you put it in just a second, I'll just get one.
Yes.
Here's a half litre water bottle.
Yes.
So we're looking at this sort of thing.
Yes.
Okay, 500 milligrams of hyaluronic acid in there.
Yes.
Topped up with water, sea salt.
Yes.
And then
you take 3 caps.
3 caps?
3 times a day.
3 times a day, okay.
Take it for about a week. It will stop most of the back pain.
That's a pretty easy thing to measure. And is that affecting the bacterial infection, or is that operating on another?
It operates by inflating your flattened disc in your back. So it won't pressure on your nerves, preventing the pain.
And did you also mention to me rubbing in hyaluronic acid with DMSO?
You can do both ways. You can rub it in the hyaluronic mixed with DMSO, or you can rub just DMSO straight in. it'll kill some anaerobic bacteria. Because slight oxidation in the area helps kill these
I see. But these are anaerobic bacteria.
They exist around the disc. They're called corneum bacteria. It's the same family group that is in diphtheria and acne.
Corneum bacteria.
Corneum bacteria.
Okay. And so if